What are toxic gases? These gases are found mainly in industries, which due to its chemical and physical properties are harmful to humans. Here are some common toxic gases. Ammonia, chlorine, hydrogen sulfide, sulfur dioxide, nitrogen oxide, benzene. Let's know how these gases can harm and how to stay safe from it. Ammonia gas, it's pungent colorless gas, liquid under pressure, elevated temperature may cause containers to explode. Exposure to ammonia can cause rhinorrhea, scratchy throat, chest tightness, cough, chest pain, bronchitis and many more. Safety measures to take for ammonia gas. Process plant should be constructed in open air and only compressors should be allowed to house inside the building. Reduction of corrosion in cooling system. Treatment to follow if affected by ammonia gas. Remove from exposure place and contaminated clothing. If ingestion of liquid. Take plenty of water to dilute if conscious. If inhaled. Shift victim to fresh air, give warm vapor inhalation with vinegar citric acid. Hospitalization for 72 hours for delayed onset of pulmonary edema. PPE to be used while working near ammonia gas. Eye face protection, wear chemical safety goggles. Skin protection, wear chemical protective clothing, example, gloves, aprons, boots. In some operations, wear a chemical protective, full-body encapsulating suit and self-contained breathing apparatus, SCBA. Respiratory protection. Up to 250 ppm, wear a NIOSH-approved air purifying respirator with an appropriate cartridge or SCBA or supplied air respirator. Up to 300 ppm, wear a NIOSH-approved SCBA or supplied air respirator. Escape, wear a full-face piece NIOSH-approved air purifying respirator with a cartridge to protect against ammonia. Benzene gas. It is clear, colorless liquid, a characteristic pleasant odor at lower concentration but unpleasant at high concentration. Exposure to benzene can cause vomiting, headache, rapid heartbeat, loss of blood cells, leukemia, death if exposed for longer time. Treatment to follow if affected by benzene gas. If someone has swallowed benzene, do not try to make them vomit or give them fluids to drink. Wash any benzene from your skin with large amounts of soap and water. PPE to be used while working near benzene gas. Eye face protection, wear chemical safety goggles and face shield when contact is possible. Skin protection, wear chemical protective clothing, gloves, aprons, boots. Respiratory protection, wear a NIOSH-approved self-contained breathing apparatus, SCBA. Hydrogen sulfide gas. It is colorless gas, flammable gas with rotten egg odor. The TLV of hydrogen sulfide is 10 ppm. Exposure to hydrogen sulfide can cause low risk irritation in eyes, nose, and throat, and also headache. High risk respiratory problem, poor memory, loss of smell, etc. Extreme risk staggering, pulmonary edema, coma and death. Treatment to follow if affected by hydrogen sulfide gas. The respiratory center may be stimulated by injection lobeline and nicotinamide. Vitamin C may be injected. Eyes should be washed with boric acid solution or isotonic physiological solution and olive oil drops be instilled. PPE to be used while working near hydrogen sulfide gas. Eye face protection, wear chemical safety goggles and face shield when contact is possible. Skin protection, wear chemical protective clothing, example gloves, aprons, boots. Nitrogen oxides. Oxides of nitrogen are generated in some manufacturing process as intermediate or as rejected wastes products. These are also produced as UV light of arc welding flame. Exposure to nitrogen oxides can cause eye, nose or throat irritation, chest tightness, choking, chest pain. Exposure to high concentrations of 100 to 500 ppm may lead to sudden death from bronchospasm and respiratory failure. Treatment to follow if affected by nitrogen oxides. Immediate and complete rest is essential after suspected excessive exposure, and the patient should be kept under continuous observation for 12-24 hours. Consider high-dose steroids for patients with pulmonary manifestations. PPE to be used while working near nitrogen oxides gas. Wear acid-resistant gloves and clothing. All protective clothing should be clean, available each day and put on before work. Face shield along with goggles. Carbon monoxide. It is a colorless, tasteless, odorless gas, which is lighter than air with a blue flame. Exposure to carbon monoxide can cause headache, dizziness, loss of consciousness, coma, convulsion open to excess exposure, death in 20 minutes. Treatment to follow if affected by carbon monoxide. If breathing is stopped, revival should be started without delay using mouth-to-mouth. Absolute rest in bed for 48 hours should be ensured. Chlorine. It is yellowish-green gas, irritant pungent odor. Amber color liquid under pressure, bleach-like, highly oxidizing agent, slightly soluble in water, very soluble in alkalis. Exposure to chlorine can cause mild membrane irritation, inflammation of lung tissues, death. Treatment to follow if affected by chlorine. For lung damage caused by inhalation, oxygen and bronchodilators may be administered. Sulfur dioxide, it is colorless gas, non-flammable, pungent and having acidic taste. It is soluble in organic solvents H2SO4, very soluble in water. Exposure to sulfur dioxide can cause nervous disorders, usually functional, may be due to toxic effect on whole body. Dental caries, rapid and painless dental destruction, loss of filling, increased tooth sensitivity, skin irritation due to formation of H2SO3 in sweat. Treatment to follow if affected by sulfur dioxide. Should be targeted to decrease SO2 in emission. Total enclosure of process with exhaust ventilation. Respiratory PPE. Cigarette smoking contains many harmful gases such as ammonia, carbon monoxide, sulfur dioxide, benzene, nitrogen dioxide, hydrogen sulfide.